What I actually just want to start with is actually just to breathe for 1 minute. So don't worry, while Amory is getting the slides, this is part of it anyway.
I can't breathe because I am.
And normally I start with this to help ground myself when I'm doing a talk, but actually what I want to show you is that we are connected, mind and body. And while we can't control a lot of what happens in our body, we can kind of take charge of some things. And one of those things is our minds. And you'll notice yourself that your mind will bounce around, it will go to things in the future, go to things in the past, and very rarely it'll stay on the present. If you've good concentration today now, you might stick with me, but at the same time, you might also feel, oh, my mind's just wandered again. It's been distracted by noise, or it's you're thinking about the coffee that's coming up, or you're wondering what's going on later. That's your mind just wandering, and it's a really natural thing to do. But sometimes our minds can wander right into the future and right into the what if and what next and what's going to happen, and that's taking you away from this present moment. So really all we're going to do for a minute, and if you can close your eyes, that would be great, because it will just help kind of center yourself a bit more. Close your eyes and just listen to my voice for a minute. And I want you to just notice your breath. So for example, I'm going to ask you to take a breath in, whatever way is comfortable for you, maybe in through the nose and out through the mouth. Maybe you prefer to breathe in and out through your nose, which is great. Our nose is for breathing, our mouth is for eating, but whatever is comfortable for you. So breathing in again, taking an inhale and taking an exhale. And again, keeping your focused attention, so that's just asking your mind to concentrate on the breath in, breathing in, breathing out. Maybe on your next breath, you could take a longer exhale. So often we think it's about getting oxygen into our body that makes us calm, but actually it's the release of the carbon dioxide. So breathing in again, breathing in, and a long exhale, letting out the release of carbon dioxide. Again, asking your mind to just concentrate on your breath if you've noticed if it's wandered. Breathing in, breathing out. On this next breath, we're going to take a slight pause between the inhale and the exhale. So breathing in, pause, exhale. And return to normal now again. Gently breathing in, exhaling out. And we'll just take one breath in and out again, breathing in and exhale. And you can open your eyes now. And you might have noticed one thing there. Hopefully you've noticed that just by taking some small breaths, you're actually a little bit more relaxed. The body has the power to calm the mind, but the mind also has the power to really stress out the body. And all you need to do is know that you're connected. We're not disconnected, head and body. So anytime you're feeling quite anxious or worried, if you just ask the mind to concentrate on the breath in, out, you're just calming your central nervous system. So automatically, you're calming yourself, okay? Think about if someone was having a panic attack and they needed to breathe into a bag. It's that inhale, exhale that calms. But actually, just by doing that for a minute, you might have also noticed how busy your mind is. Are you rushing around thinking about what's next? Were you very easily distracted? Were you able to concentrate on the breath in and out? And often that's a real indicator of maybe how busy or stressed you are. If you found that actually just for 1 minute it was quite difficult to stay present for yourself, you might be quite anxious and you don't even realize it. So by tuning into your body, you're really allowing yourself to notice, where am I in myself? How anxious do I feel? Am I really distracted? Is there a lot going on for me? And if you took 1 minute in your day, I'm going to talk about meditation and mindfulness, but I don't want loads of eye rolls because that usually happens. But if you actually just took 1 minute in your day to just say, right, Breath in, breath out. That's enough. That is actual mindful attention, and it's a really good practice for you. I think the guys are freaking out about my slides.
Melody's coming up now to fix it.
I don't mind, as long as you don't mind, because everyone's probably looking for their coffee. The messages that I want to share today is that really there are ways to look after your mental health, and the talk that I want to give on psychological recovery is really just about how you can be aware of what your thoughts are and how your thoughts are going to change how you feel. Oh, great.
There you go.
Thanks. So we already did this exercise, but really it was about, I feel like the mic's working here now. Really it was about noticing, yes, the body can calm the mind in the same way that the mind can stress out the body. So an example of that would be always thinking, but what's going to happen later? What if she says this? What if I go into a panic? That's setting off your body into panic. By breathing naturally, we can actually just reduce that state of panic. So I want to share just a few studies with you around kind of studies that were carried out with people who'd had clots. And I suppose one of the studies by Wagner in terms of reducing fear of recurrence found that there are 3 strategies that significantly reduce fear of recurrence. So a fear of recurrence in any kind of disease is just really being afraid that it's going to happen again. And when we've had a traumatic event, trauma is not just going through something difficult, but it's actually about something that stays in the body. So even though the event has passed, you can still feel traumatized by it. That means that it's actually still within your body as a kind of event that keeps you on high alert. So for example, relaxation exercises have been proven to show that it reduces a fear of recurrence. And a relaxation exercise is simply doing what we just did there in terms of diaphragmatic breathing. That's breathing low and shallow into your belly, or low and deep into your belly, not shallow up here. So a shallow breath would be, but a deep breath would be, and right down into your tummy, and then a deep release, that slow exhale that we did a moment ago. You could also listen to audio recordings, but anything that just for a minute in your day you say, actually, I'm just going to take in some time to listen to some relaxation. You can find these on YouTube. You don't have to subscribe to anything in particular. Cognitive restructuring sounds more complicated than it is, but the idea really in this study was just to get people to rethink their thinking style. So for example, you might say to yourself, an alternative to, God, what if I get a clot again, or what if something happens, or what if I'm rushed to A&E? How can you just switch or flip that thought into, I'm doing everything I can to prevent a recurrence? So instead of just telling yourself, oh look, I just won't have a blood clot again, that's almost ignoring it, or trying to brush it aside, or almost having an inner dialogue that's like, oh, just don't be silly, don't be thinking about that. That's like trying to ignore the pink elephant in the room when you've been told to ignore the pink elephant in the room. You can't just brush things aside. We do have a tendency to always think, if I just tell myself not to worry, I won't worry, but actually that doesn't work. We have to flip how we think. So instead of saying something like, God, what if, you try to flip it into, look, I'm doing everything I can, I'm following my doctor's advice. And so it's about noticing how your thoughts are and changing them into something that's more constructive. Another part of the study would be to show patients that they can schedule a worry window. And a worry window is something often we talk about in mental health in terms of people who worry all day long don't even realize that they're worrying all day long. But if you schedule a time in the day where you say to yourself, okay, here's my window of worry, it's just 5 minutes, me and a pen and a piece of paper, where I get to just exhaust my worries about one particular thing. So that means that you actually nearly drive yourself crazy by overly worrying just in that window, because you know for the rest of the day, you say to yourself, oh no, I've given myself my worry window. I can't keep worrying about that now. So hopefully it's a way to just say to yourself, okay, I'm going to exhaust things that I can do in a practical way. So like that, look after my diet or go to see my doctor, and then exhaust myself in ways whereby it's out of my control, and I've allowed myself to worry for 5 minutes, but I'm not going to let that carry on throughout my whole day and ruin my whole day. So outside of this study, another evidence-based practice in terms of trying to boost mood or get yourself out of anxiety is to practice gratitude. And it's become kind of quite common sense these days. I know especially for women, there's lovely gratitude journals. It's become a lot more part of our language that actually what I appreciate appreciates. And it might seem like a really simple tip, but it showed that actually in this study it improved mental health and well-being, reduced distress and reduced death anxiety just by doing this. So you can do it in lots of different ways. You can spend 15 minutes a day focusing and writing on something that you're grateful for. You can wake in the morning and automatically program your mind to think of something that you're grateful for, whether it's just the bed that you're sleeping in or the fact that you're about to have a nice cup of coffee. But it's about training the mind, and I'm going to speak about the mind in a moment, about where you have control over it. So these are just tools that you could take away today where you say, actually, I am going to list 3 things at the end of my day that I'm grateful for, because what you're doing then is you're training the mind to look for the positive instead of always focusing on the negative. And when I say that, I don't mean a negative person, or when people give out about themselves and they say, oh, I know I'm so negative, I'm always worrying. That's okay, we're programmed to be that way. I'm going to share some evidence on that in a moment, but it's actually just about training the mind to focus on, actually, what am I already grateful for? What do I appreciate? Because when you do that, you start to navigate a way of looking at the world through a positive lens. This is just an example of what a 6-week gratitude exercise would look like, where you have a diary, where you just express gratitude by thanking someone, or you just appreciate the good things in your life. So you could have just a grateful or gratitude mantra. And just in general, that you just start to notice for yourself, how much am I focusing on what is positive, or how much am I focusing on what's negative? So mindfulness meditation, there's so many studies, and this is just an evidence-based by Jon Kabat-Zinn, to show that over 10 weeks, it really reduces distress, okay? And it's really, there's a lot of evidence, especially in terms of mindfulness in cancer patients, because what actually happens is that when you practice mindfulness, you're actually changing the telomeres, which are on your genes. It's like the top of a shoelace where there's a little plastic bit. We have that on our genes. That becomes more frayed with stress and with age. But actually, when you practice meditation, it shows over 10 weeks, when they look on scans and when they look on neuro exams, that basically our telomeres are less frayed. So the evidence is there. It's not just about breathing and trying to zone out. The evidence is there to show that if you practice meditation, that you can actually reduce distress. But when I say that, I really mean just even that 1 minute that we did earlier is enough. Okay, I remember last year actually when I talked at this, we all left saying, right, we're just going to do 1 minute, because when you think of 1 minute, it's so much easier than thinking of, oh God, 10-minute meditation, I can't do that. But actually, if you just think about it for doing it as 1 minute in the day, mindfulness is simply a method of mental training. Okay, so it's that idea of just noticing my mind wanders, how do I bring it back to the present? Professor Jon Kabat-Zinn, founder and former director of the Stress Reduction Clinic at the University of Massachusetts Medical Center, helped to bring the practice of mindfulness meditation into mainstream medicine and demonstrated that practicing mindfulness can bring improvements in both physical and psychological symptoms, as well as positive changes in health, attitudes and behaviors. So I really just want to emphasize that just by focusing on your breath, you're doing so much for yourself, okay? It doesn't have to be a 20-minute yoga position. It doesn't have to be 10 minutes of quiet. It can literally just be 1 minute of training your mind to bring it back into the present moment. And the results show that you have an increase in happiness, you have a longer and healthier life, you have a decrease in anxiety, depression and irritability. Your memory improves, your mental and physical stamina, your relationships improve, your immune system improves, and chronic stress and chronic pain reduces. And if you are suffering from any physical or chronic pain, I would really advise to look up Jon Kabat-Zinn on YouTube, where it's the idea that basically the more we can sit with what's difficult without our mind wishing for it to be different, the better it will be for us. Because if we're in a situation which is difficult, the more we resist it, the more difficult it will be. It's not to say that you have to give in and give up. It's to say that the more we surrender to what's happening and not fight with ourselves that it's happening and wish for it to be different, the easier it is for us to tolerate. Yeah, so it's, let's say for example, it's raining today, and I keep saying to myself, oh, it's raining, like why is it raining? This is so annoying, it's ruined my day, I can't do anything now. That anguish that I'm causing myself with the thoughts is causing myself more distress than actually just saying, oh, it's raining. Like, oh sorry, John Kabat-Zinn. Yeah, so here we go. Yeah, there's his name there. So he does a lot of work, well he did, with pain, physical pain, and it's the idea of mindful-based stress reduction. So it's about sitting with the pain, not giving in like it's hopeless, but rather I have to surrender to what this is, and how can I help myself psychologically do that. But I'm glad I gave you the rain example all the same. So, complex brains, all I really want to share with you today about this, and I hear it all the time when I talk with patients, is that it's not our fault that our brain is programmed the way that it is, okay? We share the same reptilian brain that evolved over 200 million years ago, and basically we're programmed to react in certain ways. We're programmed to want to protect ourselves. So you may have heard of fight, flight, or freeze, but basically it's an automatic response. And so when you know that you're actually programmed to worry, you can stop giving out to yourself about that. All we can work on is trying to reduce the amount of time we spend worrying. So if you think about a fork in the road, what we want to do is we want to just try and not take the automatic route to, oh my God, the danger, what's out there, something's going to eat me, which is what we were programmed to be like, but rather, actually, I'm going to work on calming myself, taking the other road, which is really into the new brain. And the new brain is the prefrontal cortex, which allows us to imagine things, to consider our future, to think about thinking, to reflect on the past. So while maybe in animals, they can only, they only have the brain capacity to be in the moment and not think about things or imagine, or at least we don't know how much they can do. But the point is that while this is brilliant that we have this new brain, it also means that we then tend to kind of worry more. So for example, you get a call from your consultant, what do you think? Great, they're calling me for a chat. No, probably not. You're straight into, oh my God, why are they calling me? Because that's what we're programmed to do, okay? So the problem is, though, that we get into these thinking loops between the old brain and the new brain. So the old brain, while it's there to help protect ourselves, the new brain imagines all these events that haven't happened yet. And that's brilliant when we start to think about, oh great, I'm going on a holiday in 2 weeks, what's it going to be like? But it's not so great when we think, oh my God, my consultant's just phoned me, what am I going to do? So the way to break out of that thinking loop is to, one, give yourself the awareness that, okay, I'm programmed to be this way. But the second thing is to realize that actually I've had an event in my life, such as a shock, such as maybe a clot or a physical problem, that's now caused my whole body to almost be on even higher alert. So while you're already programmed to have this mind that protects you by looking out for things that could be dangerous, if you've had an event in your life that has caused you distress, that's been traumatic, that's going to stay somewhat in your body, okay? It's going to almost stay in your nervous system. And so this is known as the stress response, okay? And it happens basically when it's like a little alarm in your mind, signals to your body, oh my God, there's a threat, okay? And when you feel under threat, you react in a way which could be running away, fighting, or freezing almost on the spot, okay? The more you're just aware that this happens automatically in your body, the less you'll give out to yourself about how you respond. And then you can start to notice, how can I respond in different ways? So for example, we go into this doing mode when we're under stress. So fight, attack someone or go on the defense or actually physically, hit someone. We go into flight, we run away, we avoid, we don't want to talk, we try to ignore our feelings, we don't want to get into conversations, or we literally leave a situation, or we freeze, which is mean that we almost shut down. We don't really know what's happening for us. We go quiet. We might even retreat. And the thing is that we are actually human beings, we're not human doings. So the more we can kind of step out of these automatic responses by actually giving ourselves the compassion to know, okay, hang on, at the end of the day, I'm pretty much an animal and I have these automatic responses. So I can allow myself the permission to know that I'm almost programmed to be this way, but what can I do about it? How can I calm my system down? And one of the ways of doing this is to recognize, okay, it's how I respond to a situation, okay? So it's not always the traumatic event, it's how I respond to it. And really that's what resilience is. It's not a state of being, it's a process. It's saying to yourself, okay, how can I bounce back from this? So our future resilience lies in your past struggles. So how have you gotten through things in the past? And I often asked patients this and they say, oh yeah, I just got on with it, I just ignored it. And I'm like, how did that go for you? And the thing is that it doesn't go well for us when we try to ignore things. So we need to really acknowledge them, and we need to acknowledge actually what were my strengths and how I got through something before. Flexibility in response is key. So again, you know the way you might say to someone, oh, they're really good at managing stress, or they're really good at thinking about things differently. Well, how can you be flexible in your thinking? Similar to what I said earlier, how can you just flip your thought from, oh God, what if that happens, to, it's okay, I know that I'm managing this as best as I can. I've spoken to my doctor, I'm minding my diet. So it's about flexible thinking. Psychological flexibility is the bedrock of resilience, and that's basically, again, just saying, how can I look at this from a different perspective? How might someone else look at this problem? So see the positive, but that's not all. So when I say see the positive, that's not silver lining thinking, because often when we have silver lining thinking, we go, oh, well, I guess it could have been worse. That's not acknowledging that it's already been hard, okay? It's actually better to think of it in terms of the AAA. Think of a AAA on a battery. Acknowledge, allow, and appreciate. So acknowledge what's happened. That's saying, yeah, that was really difficult. That was scary. Allow yourself to feel what you need to feel. So let's say you felt really afraid. Energy and emotions come together. So for example, any feeling that you have needs to be expressed. I know that a lot of time people will come to counselling and think, all right, so I just talk to you and then what happens? You just listen. But actually it's the expression of it. Think about a dog that comes in from the rain and shakes off everything. That's a physical letting go, okay? So often we have fear in our body. How do we express that? Maybe you go for a run, maybe you scream and shout, hopefully not at someone, but just letting it out. And really you have to be aware of, how do I let this go? And maybe it is a good cry, but it's allowing it to be as it is, because the more that you hold it in your body and restrict it, the more tension it causes, the more stress that you have. And then appreciate yourself. Not appreciate the bad thing that happened, but appreciate yourself for, actually, I am managing this, and this has taught me something about myself and how I now want to live my life. Okay, so for example, you might have gone through something difficult. You're not going to appreciate the difficult thing that happened, but you're going to appreciate that actually you're living your life in a new way. And it's not to always say that there's a message in what things happen, but actually there is always learning in what happens, and it's about how you want to reframe that learning. Apologies if I'm going too fast, but I'm aware that we're running out of time. So three factors that determine people's ability to bounce back. So your perceived competence in dealing with the stressful situation. So just think of a weighing scales. Okay, if I'm thinking about today and how I'm going to present this, and I'm really worried, I'm like, oh, I'm not going to be able to cope, this event is up here and my ability to cope is down here in a weighing scales way, then I'm going to feel stressed. Whereas if I reframe that and think, everyone's going to love me, this is going to be fine, I'm not going to meet my old colleagues from my last workplace, then my ability to cope is up here and the stressful event is down here. And all I did in that was switch perspective. And I don't know either of those is true, but I'm going to lean on the one that makes me feel better. And it's not denial, it's actually just a way of flipping your mental thought. So your resilience on core values when responding to stressful situations. So again, like, is it about what matters to you? Who matters to you? How can I best respond on this? And then your level of avoidance of stressful feelings. So again, trying not to avoid what's difficult, but trying to allow, acknowledge, appreciate what you're going through. And different ways to become more resilient. Just to think, it isn't that you're just born as a resilient or a strong person. Again, it's about saying, how can I look at this different? How can I think about this different? It's developed through willingness and purposeful action. Having psychological flexibility, that's just about changing how you're thinking. Knowing your stressors, so maybe it is like big events, or it's presentations, or whatever it is for you in your life, but knowing what they are and either limiting them or changing how you respond to them. Having social support, being present, so again, that's just your 1 minute of breathing in, breathing out, anchoring yourself with your breath. The reason meditation is all about breath work is because we always have our breath, So it's not like we have to carry a device to remind us of being in the present. Our breath anchors us to the present. And when you ask your mind to concentrate on that, in and out, you are in the present. And practicing self-care. And self-care really is just about acknowledging what you're going through and not trying to avoid or change what you're thinking or feeling, but rather manage how you're doing that. And I'm just going to give you this stop technique. So we can see here that stop stands for stop what you're doing and notice the thought, okay? So this is where you become a little bit more reflective in life. This is where you can become a little bit more self-aware. So in any situation, you might even notice it today, you're having coffee with someone and you become aware, oh, actually, I'm kind of drifting off here now, or what's happening for me? You just stop for a moment. You don't have to have this verbal kind of conversation with someone about what's happening, but you're just noticing reflectively within yourself. You take a breath, again, the other person mightn't even notice. You're just breathing in, breathing out, and you're just observing what's happening. If you're on your own, you're just taking in the surroundings. You're letting yourself be grounded by what's going on around you in the present moment. And then you're proceeding with a different type of concentration and presence. And you will notice people in your life who are really present to you. They're the people who are looking at you, making eye contact, not kind of drifting off. And you'll be amazed the more you start to notice this in your life, the more present you'll feel. Because actually, if we take care of this moment, the next moment will take care of itself. And often when we're in difficulty, if you can just say or acknowledge just this, just now, instead of where the mind takes us, as I just said, programmed to take us to worry or programmed to take us to things that we need to protect ourselves from. But actually, if we just say, just this, just now, we can be totally calm and we can totally cope because we haven't overwhelmed ourselves with too many thoughts. So I just wanted to end maybe with managing stress, with taming the monkey mind. And if you do meditation, you might be aware that the mind is often referred to as the monkey mind. And the idea being really that the mind just jumps around from thing to thing. But actually, if you say to the monkey, here, come here, I have a task for you. I want you to just focus on the breath, that the monkey mind will obey and will listen, okay? So you can have different analogies to what your mind is like. I have small children, so sometimes I think my mind is like small child, just going, mommy, 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 looking for my attention. So whatever works for you, but basically to know that you are more than just your mind. You're your mind and your body, and by connecting with your breath, you'll become present in this moment, and this moment you can manage, okay? So let's just do this last task. So if you can, and try not to fall asleep, let's just close our eyes again and putting your 2 feet on the ground, and maybe if you can, just allowing your spine to be upright. This signals to the brain that you're present and alert. And again, meditation or mindfulness isn't about trying to go to sleep. It's about just taming this mind that we have that's so active and programmed to always look out for danger. And we're so grateful to it for doing that, but sometimes it stresses us out. And so a way to calm your nervous system is to focus on the breath. And when we do that, and when we do deep breathing, we're signaling to the mind, I'm okay. I can cope in this moment. So again, just notice your breath in and out. Maybe take the breath in through the nose, out through the mouth. And try and make it nice and deep. So it's through the nose, low and slow exhale. So when I say low, low down into the diaphragm. So breathing in again. Low into the diaphragm and exhaling slowly. Breathing in again. Low into the tummy, and if you like, maybe place your hand on your tummy just so that you can notice, is the breath going into the diaphragm? You should feel a gentle rise if you're getting it nice and deep. And then on the exhale, a nice gentle fall. And just notice for 10 seconds what happens in the silence. again, bring your attention to your breath, breathing in, breathing out. And what you may have noticed is that you could have been distracted by sounds, you could have been distracted by thoughts, maybe physical sensations. But the mind most likely wandered in that 10 seconds. And if it didn't, and if you stayed concentrating on the breath in, breathing out, then you're already there, you're already present. But for most of us, our mind is busy and it will jump and distract you and take you away from being here in your body. And sometimes that's helpful, but most of the time it takes us away from where we really are. So when you begin to notice that actually I can start to train this monkey mind, I can ask myself for 1 minute in the day to focus on my breath, breathing in, breathing out. And knowing that of course our breath happens automatically, but the more you can focus on it, deepen it, breathe right down into that diaphragm, exhale slowly out, the more you'll be working on calming yourself, bringing yourself into the present, and absolutely enjoying life fuller. So again, breathing in and breathing out. And when moments are difficult, to just say to yourself, just this, just now, so that the mind won't overwhelm you. And when the moment is good, that you can just say, just this, just now, so that you're fully present, enjoying it. Because as we know, nothing is permanent, not even pain. So for your last breath, think about breathing in, and on your exhale, letting go, really releasing either any physical tension you feel, any stress that's in your mind, and bringing yourself into this moment. So breathing in and exhaling, letting go. And when you're ready, opening your eyes and taking the sentiment of just being calmer, feeling calmer maybe in your body, and taking it with you through the day, and knowing that you can take care of the basics, so your sleep, your diet, your exercise, asking for social support, and your relaxation. But you can also really mind yourself by watching your mind and bringing yourself back to the present. The stillness and space of mindfulness allows us to move into recovery mode as we take some time out from the frenetic pace of activity or worry that many of us live with. So think of it as a mental break every time you just take a pause, or every time you use the stop technique, or anytime you just concentrate for 1 minute on your breath. That is not only psychological recovery, but it is really enhancing your physical well-being and your mental well-being. So I hope you enjoy your coffee, but if you have any questions, please ask. Thank you.
Visit thrombosis.ie. Spot the signs, save a life.